We will discuss Kartagener syndrome in the 5 mark short note series. Kartagener syndrome is a congenital disorder of ciliary motility forming a subset of primary ciliary dyskinesia. It presents with a classical triad of bronchiectasis, chronic sinusitis, and situs inversus. It is first described by Manus Kartagener in 1930s. So, what is primary ciliary dyskinesia? Primary ciliary dyskinesia is a rare autosomal recessive genetic ciliopathy that causes defect in the action of the cilia lining, the upper and lower respiratory tract, the sinuses, eustachian tube, middle ear, fallopian tube, the flagella of the sperm cells. So, as you can expect, since the cilia in these areas are compromised, there will be infertility, frequent infections of the middle ear, bronchiectasis. It is very rare, wherein 1 in 15,000 to 30,000 live births it happen. It is equal in both sexes. Higher prevalence in consanguineous populations. Mutations is in DNA H5, DNA I1, CC, DC39 genes leading to defective dynein arms in the cilia. So there will be situs inversus finding in the X-ray where everything will be reversed. So the heart shadow will be here instead of being here. Sinusitis will be there and bronchiectasis will be there. So the pathophysiology is there will be defective ciliary motility, impairs mucociliary clearance, leading to chronic infection. Then this leads to defective embryonic ciliary motion, resulting in situs inversus. Then defective sperm flagella leads to infertility in males, subfertility in females. Coming to the presentation in neonatal period, it presents with respiratory distress due to poor mucus clearance, recurrent sinusitis, otitis media, and chronic cough. In adolescence, it presents with bronchiectasis, chronic sputum production. Whereas in case of adults, there will be infertility and subfertility in males and females respectively. The findings include recurrent sinus ear, chest infections from childhood, dextrocardia or situs inversus in imaging as you can see in the chest x-ray, fingers clubbing, voice crackles, nasal polyps, and chronic coughs. So coming to the investigation, chest X-ray or CT will show dextrocardia and bronchiectasis. There will be mucosal thickening in the sinus when CT is taken. Sperm motility test will show immotile spermatozoa, though they can be artificially using artificial insemination technique. Pregnancy can be achieved. In electron microscopy, there will be absence of dynein arms and the nasal nitric oxide test it will have low levels. So immediate and long term airway clearance, chest physiotherapy, postural drainage and nebulized saline. Infection control can be achieved through antibiotics and vaccinations, ENT management for sinusitis and otitis media, assisted reproductive techniques for infertility, and regular follow-up and pulmonary monitoring is required. Coming to the prevention and prognosis, genetic counseling and avoidance of consanguineous marriage, a prenatal diagnosis if family mutations are very well established. Prognosis is a progressive bronchiectasis causes chronic respiratory failure and there will be usually short life expectancy. So this, to summarize, Kartagener syndrome is chronic sinusitis plus bronchiectasis plus situs inversus. Recognize this early, manage the infections, and preserve the lung function as much as possible. I hope you have learned through this short note presentation. Thank you.